just want to give you a warm welcome, and I want to introduce our guests today, Brad and Martin from Care England, who will introduce themselves to you shortly. I want to say that artificial intelligence is rapidly reshaping industries, and care homes are no longer an exception. So today we really want to explore how AI-powered acoustic monitoring is driving a real shift in the reactive to a proactive approach within residential care services. We want to talk about the biggest challenges in care homes and how artificial intelligence solutions, like we're going to hear from Earzz, are here to help shape the future of AI within social care. So I'm going to ask my guests, Martin and Brad, to introduce themselves to you now. Martin.
Hello everyone, I'm Martin Green and I'm the Chief Executive of Care England, and as many of you will know, we're a representative body for care providers, and one of the reasons why I'm delighted to be at today's event is that we have technology, innovation and particularly AI as one of our key areas of priorities, because we do think it's going to reshape the future of care.
Fantastic. And would you like to introduce yourself?
All right. Thank you so much there, Richard and Martin. I'm Prad Thiruvenkatanathan. I'm the founder of Earzz. It's a business I started about 3.5 years ago now, with a vision to really help improve accessibility for deaf people and also the care sector. So to enhance the quality of care in the care sector. And I'd love to jump in and show you a little more about what we're doing today.
Fantastic. Thank you very much. We'll dive straight in. We want to talk about the key challenges in the care sector. So let's talk about those challenges and what challenges are facing care homes today. So Martin, what would you say are the key challenges that you think the care sector is facing?
Well, of course, we all know that the care sector has some significant funding challenges, but on top of that, we have some staffing issues. We have a sector that requires to have much more staff. And of course, if we look at how the future is going to pan out, we've got demographics that are going to tell us we need far more people in care, because the numbers of people who are going to need support are going to be significantly increasing. I think one of the other things that we need to do is to move from being a reactive sector to one where it's a proactive approach to care, so that we can make sure that we're doing everything we can to support people to live the best life they can, to maintain their independence, but also to be so proactive that they don't go into the next level of dependency. So I think that's a big issue for us in the care sector. I think also we've got some major issues around things like falls. And if you look at the data on falls, you'll see that about 40% of those result in hospitalization. Now, that's really bad for the person, but it's also, of course, bad for the system. So we've got to start downstreaming and we've got to do preventative work. And that's where I think technology is going to be a game changer. And that's why I'm really pleased to be involved in today's seminar, because we'll be able to unpick not only the big issues for care, but also what might be the responses for the future.
That's great, Martin. Yeah, I think falls cost the NHS about £4 billion a year. So there's a huge opportunity to help the NHS reduce those costs. The care sector needs scalable, proactive technologies, and we need to reduce the risks within residential services to ease pressure on the NHS. We need to ease the staff burdens and enhance dignity for our residents and the independence you talked about. Artificial intelligence-based acoustic monitoring does really represent a major shift towards the predictive and preventative type of measures. So it's probably a good idea to look at, talking to Brad now about how technology has really reshaped some of the industries that it's worked in and how we can do things very, very differently. If we start looking at technology and how it's evolved over the years, AI is really the buzz at the moment across multiple sectors. And it's really impacting how we do things proactively. It's starting to be more predictive, and there's really some behavioural things coming out of it. But in terms of operationalising technology, acoustic technology has been around for some time, but we've really seen how it's starting to help and shape the quality of care. And I think Earzz has been making some inroads in this AI-powered technology monitoring for quite some time now. And I wonder, from Brad's perspective, whether you could talk us through that, please.
Absolutely. Well, thank you so much, Richard and Martin. It's very insightful, as always. We at Earzz completely resonate with this ideology of building technology that lifts staff burden while giving them the insights needed to administer proactive care as well. So with that said, let me dive in and show you a little more about what we do here at Earzz. So as far as the mission goes, as I said before, we focus on delivering connected sound recognition AI solutions that enhance the safety, accessibility, and quality of life in multiple care settings. And that's been the focus. And we do that through this technology that we've built, sound recognition AI. But what do I mean by that, right? So that's the first question that comes to people's minds when I say sound recognition AI. And Richard, you mentioned acoustic monitoring there as well. So if you think about acoustic monitoring, the first thing that comes to your mind is a baby monitor. So you've got a transmitter, you've got a receiver, and somebody, a parent leaves the transmitter in the baby's room and then listens to what happens in the room on the other end through a receiver. And this obviously means there's somebody constantly listening to audio feeds on the other end, which takes up a lot of time. So if you think about what we have as acoustic monitoring solutions in the care sector today, the similar principle has taken shape here as well. It's an audio relay-based system that you would see in the market most likely. But what we do is not that. So we do acoustic monitoring, but what we've done is we've built the smarts in this little pod for it to understand, recognize, and delineate the different sounds automatically, lifting the burden away from the carer to sit there listening to audio feeds. So it can tell the difference between a number of different sounds. And why is that useful? It comes in very valuable in a whole bunch of different care settings. So if you think about residential care, and you have falls, as Martin mentioned, the size of the problem here is pretty immense. And Richard, thank you again for highlighting how that affects the NHS as well. These are pretty big issues to deal with when it comes to falls. And this system can understand and delineate the sounds of movement, as an example. It can tell when the person's trying to exit the bed, when they're trying to get out and start walking in the room as well. And this can then send proactive alerts automatically to carers who can then come in and intervene at the right time to prevent a fall from happening. It also comes in very valuable in nursing care settings. So the system can tell the difference between coughing, screaming, shouting, and that becomes very useful when it comes to proactive care planning for pain management. And I have a very nice case study that I'd like to share as well, where you can see how the system starts alerting for specific sounds of shouting in the room when the person is in pain. And that was used to change the medication strategies as well for the resident. And you could then see the impact that was having in the resident's well-being and quality of life. You can also use this to tell when the person's coughing. So as the residents, let's say there's an infection spreading in the care home, so you can start getting insights into which residents are getting a cough and how that is spreading through the home as well. So all these are quite powerful insights that you can get from it. And besides the alerting capability, we think there is huge value in behavioral patterning. And what do I mean by that? That means instead of simply alerting, we also keep evidence records of when those specific sounds were heard. So it says this person was coughing in this room at this time in the night. And that's a digital record that's kept. And that's then used to pattern the behavior of the person as well. So if the person's coughing a lot more or screaming a lot more, you then get immediate alerts as managers and caregivers to that fact. But also you can see the times when the person has a tendency to cough at night or has a tendency to scream at night. So all of that becomes very visible, which again can help move the needle from reactive to proactive care, a bit like what Martin, you were saying before as well, and the need for doing that. How does it work? It's pretty simple. You would install the monitor, well, we would install the monitor in the resident's room. So the installation would look a bit like this. The monitor would be affixed to the wall right next to the resident's bed. And you as a manager, you can choose the sounds that are relevant for the resident. So at Earzz, we don't believe it's a one size fits all. So you would be able to tailor, as a manager, you can tailor the sounds that are very relevant for the individual. So if the person is of a higher falls risk, you can then select activity related sounds, movement related sounds. So as soon as there is any movement in the room, carers can get alerted for the sound movement and they can come in and intervene instantly. Equally, if the person is relatively independent, they don't have any movement or falls risk, but rather they would benefit from getting, if they've got, let's say, pain management related issues, then you can select screaming and coughing and shouting. And these specific sounds can then be used for alerting purposes as well. And any alerts that come through can go to multiple carer devices simultaneously, all on their DSCR handset or the CMS system that they already use. So if you're using the likes of PCS, CareVision, you can get the alert straight onto your mobile devices that the carers already use. So it's not like they need to carry multiple devices on them as well. And there is no listening on the other side, as I emphasized before. So any sound that is heard is then processed by the AI. It then works out what the sound is, and then it sends the alert, like what you see over here. That is quite visual as well. It tells you what the sound is. So when the carers look at this, they know that there is movement in room 5. So they don't need to sit there listening to understand what the sound is, and then delineate it by themselves. That saves them time, but also the precious minutes that can tell the difference between falling and not falling. Any alerts would also have this question. So we've realized embedding the technology into the operations of a care home is a key step. So and making that as simple as possible is quite important. So in this case, it's a nice example that I'm showing over here. So in room 5, there sounds like movement, and let's say there are 5 carers who you've configured to send these alerts to. All 5 of them will get this alert, as you see over here. And let's say 4 of them are busy with other residents at the moment, and 1 of them is able to go in and attend. And so this alert would ask the question, will you be attending? And when that carer taps yes, it also sends the alerts to the other 4 carers that carer 1 will now be attending to room 5. So they are very aware of what the operations are, even though they are not right next to the room or looking at the carer at that time. And once they are in the room, they could simply tap the button that you see. So that's the monitor there, and there's a button on top. And the moment they tap the button, it also digitizes and physically evidences the room check. So this is an important part in operationalizing the system, because now it's not just about sending alerts, but it also tracks the responses of the carers and how quickly or not they are attending to residents, which is extremely valuable from an evidencing standpoint as well. Let me pause there. Any questions here, Richard or Martin, before I jump in?
I think the analogy of the baby monitor is a great analogy, because you can't have in a 40-bed care home 40 people listening to the monitor when to do something. So I think with the AI looking at the patterns and behaviors and learning that this is different to what this person normally does, and setting you alerts, and you can be kind of far more proactive, is really, really, really important to show that we can start proactively dealing with things before they become a problem. And I think the infection prevention control issue is really great. If we start to see sense of coughing in one part of the care home, we can see how that's going to kind of progress, and we can stop it before it progresses the whole home, and help people to kind of isolate where appropriate, or to kind of look after them and care for them, so that doesn't become something spreading throughout the whole home. It's fantastic technology.
Absolutely.
Yeah.
Thank
you. Yeah, and I'm really impressed as well by how practical it is. So, for example, if there are 4 carers who are busy doing other things, they'll be alerted that one person is on their way to that. So it's very sophisticated in terms of it being very much about an automated system, but it also is quite operational in saying, this is the best way of using staff, so that not everybody will converge on that particular room.
Absolutely, Martin. And again, we believe in this, right? So you may have the best technology under the sun, but if the carers are unable to use it, or if it's not embedded properly in the system, it may not add the value it's supposed to add. So I think there is that element here as well. And in talking of impact, we've had multiple case studies now that are in the public domain, which I'd be very happy to share with any of our viewers, where we demonstrate a significant reduction in falls thanks to proactive alerting that comes from Earzz. And besides the fall reduction, I think one of the genuine benefits is behavioral patterning and the improved responsiveness and sleep as well for residents. In this case, when you think about responsiveness, we are talking about evidenced improvements in responsiveness of not just 25%, but 25 times. So I'll show you the actual evidence. These are just numbers, but what would be really powerful is to show these numbers and evidence that in a true setting. So I'm thinking we could jump straight into a dashboard right now, and I can show you the data in action in a care home setting, and you can see how powerful this can be as well. With that said, let me jump straight in actually to the dashboard, so you can see the data in action. Can you see my dashboard here, Richard and Mark?
Yeah.
Yeah.
Okay, very good. So because the system can understand and recognize sounds, it's not just about relaying audio. So you can now go in as the care home manager. You can go into the to this screen over here, and you can choose the sounds that you want to look at. So let's say you want to look at who's been coughing. I could select cough, and I can simply choose the time window here. So I've chosen 2nd to 16th, as you can see. And this is 10 p.m. to 6 a.m. as far as the time filter goes. But I could equally choose 8 p.m. to 8 a.m. I could choose 24 hours. But in this case, let's choose 10 p.m. to 6 a.m. right here. And what you see in the graph underneath is the occurrence of coughing, specifically the occurrence of coughing, not just any sound, but coughing in each of these rooms. So you've got 10 rooms here, and you can clearly see just by looking at this that the residents in room 8 and 10 are the ones who are coughing a lot more than the other residents. And I did mention I was showing, I wanted to show a case study where there was one person who had a pain management related issue. And so that's the resident in room number 1. So instead of coughing, if I am to select screaming sounds, you can now see that it's no longer rooms 8 and 10, but the person in room 1 is the person who is screaming a lot more than any of the others. We also learn from managers as to how busy they are. So feeding the information and the insights that can really help them with the care planning and doing that as quickly and easily as possible is always important. So we've included this one feature where you can simply go and hit anomalies. And the moment they choose anomalies, the system works out what the median is across the entire home and who's anomalous. So it points it out to you almost instantly. And it also works out what the average occurrence of that sound is for that resident in that room within the time duration and the date duration you've chosen. And in this case, this person was shouting 15 times a night on average for the 2-week window that you've got. The first question the manager asked when we showed this data was, can you tell me the times when the person is shouting? We know they're in pain, but can you tell me the times when they have a tendency to shout more or scream more, so we can change the medication routines and adjust it to see if that helps. You can now do that with one click, Richard and Martin. It's literally one click. I just go click once, and the system does all the math for you. It's taking room number 1, it's taking screaming at the date and the time range over here, and it's then saying that the person has a tendency to shout more between 11 and 1 at night in pain. So this was then used to try and administer pain medication slightly differently, and you can track the result as well. So that's what you see here. So this is screaming sounds on a daily basis. You can see how that is changing based on changes that you may have made in the medication strategy that you've got as well. So you can see if it's working, and even if it's not working, you can then track what the actual changes in the restlessness of the person and if they're having a better night's sleep. We're talking screaming here, but we can also look at other sounds. So let's also choose movement noise as an example. And instead of looking at holistic trends, we could even look at what happened on a specific day. So we can choose the 7th or even the 8th. And let me also go back and choose a smaller window of time. So with this system, you could look at what happened on any night, specific night, and you can look at it down to the minute. So you as a manager, you can see and evidence the data down to the minute. So that's 5 minutes. This is 1 minute, and you can see the data changes, and that's the night of the 8th of October. So what you're seeing here is the same room on the night of the 8th of October with a 5-minute granularity. And the colors here represent the different sounds. Because the system can identify and delineate the differences in the sounds, here we've represented movement noise in green, and blue is screaming sounds as well. And we did mention, the system at least identified that the person had a tendency to shout or scream more between 11 and 1 at night. And you can clearly see the shouting sounds were heard between around the 11 to 12 mark over here. And if I go back to the 7th, let's say, you can see it's 12 to 1 as well. So you can begin seeing those insights directly. And you can also see this little orange dot over here. And anytime the carer goes into the room based on the alert and pushes this button, an orange dot shows up on the dashboard. So you can now see there was screaming sounds heard at 11:10, and the carer went into the room within 10 minutes of that event. You can also see the similar sort of behavior, 11:45 screaming sounds, and the carer went into the room at 11:50 to register their care for the person as well. And you can also see very responsive care towards the early hours of the morning here. But interestingly, between 11:50 to about 4:30, there was no sound of concern as chosen by the manager for this person heard in the room. That gives you an indication that the person was sleeping better at nighttime as well. And you're seeing that sort of behavior coming through, not just in room 1, but you can also see it in other rooms. So this is room number 2 as an example. And you can always see, And this is again going back to the power of sound recognition. So it's not just relaying any audio data, it's actually understanding what the sound is. It is then looking at the patterns there and then showing you when those specific sounds that you've chosen are heard in the room. And this can also mean that unnecessary checks, as an example, could be avoided in certain instances. Let me pause there. Martin, Richard, do you have any comments on this?
I think it'd be great just to hear from Martin actually around kind of where Martin sees the value and the impact that this could have operationally within a care service.
Well, I mean, I think it's brilliant because it not only identifies when there are issues, and you can take those issues and make sure that the person who's in that service is getting the best possible support, but operationally as well, you'll be able to see where the needs are in terms of how you develop your rotas. You'll be able to see whether or not, for example, I was really impressed with the fact that you could identify 2 rooms where the coughing was worse. So you can say, right, we might need to really address the issue of infection control around the whole of the home, but in those 2 particular areas to make sure that it doesn't seep out to others. In terms of the staffing as well, you'd be able, for example, if you had somebody who was a specialist in pain, or you wanted to use supplementary pain services to make sure that that person had their pain reduced, and particularly, you know, people living with dementia, it's often difficult for them to identify that they've got pain, but here you can clearly see their responses like shouting, etc. So you could then bring in specialist support. So I think the benefits to this are absolutely amazing for the people who live in care services, but they're also incredible for the people who run care services, because you can target your interventions to make the biggest impact.
Yes. Thank you so much for the comments there, Richard and Martin. And there's one other point that I wanted to mention. You mentioned dependency there, Martin, and also the needs. This is a nice example over here. So this is from a resident in another room. And what you're seeing here is data not just from one night or a couple of weeks, but actually 2 months, all in one shot. So what you're seeing here is the data from 2nd of December all the way to 16th of January. And you can see that the resident was, did not have any restless nights. It was very normal in terms of what was happening up until Christmas Eve, unfortunately. And then you can see the person's coughing a lot more. They have some respiratory problems, and they are a lot more restless than they were just a night before. And that trend has now continued. So you can now see the needs of the person have completely changed. And also, while previously if you think about existing systems, most care homes tend to just write them down as notes. A carer just types on, okay, respiratory problem, there's a breathing apparatus, and you sort of rely on those notes for your dependency assessments as well. But in this case, you have evidence data now. So you can now see that the person's needs have now completely changed. The person's coughing a lot more, 10 times, 20 times. I can quantify it. You can see the quantified evidence of the person's change in need. And you can also see that the person's got a lot more restless. But more interestingly, we also digitize room checks. So you can now see if the carers are also going in a lot more, because the needs have now changed. So the same carer is now spending 5 or 6 times more time with this resident as well. So all of that's now fully cataloged over here. And talking of responses, you also have this little tab over here, which is response time. I can go into the response time here. Let's select the same room that we were talking about and the same time window that we were talking about. In this case, by selecting the same time window with the same room, you can immediately see how responsive the carers were. So this comes and tells you what the average response time for that room was. And it also tells you how responsive the carers were across each hour during the night as well. So you can see all of that information instantly as a care home manager. You can then compare it with the likes of another room, and you can already see a slight difference. So you can now use these for operationalization, right? So you can now see which rooms are getting attended to faster, which rooms are getting attended to slower, and then you can plan your care around it, knowing the behavior of the person as well, which is very important, because with this data, you can now see that the person has a tendency to be moving at certain times. So you can get all of that information. If I am to select all of the rooms here, it also gives you what the average response times were. And if you now compare this with the likes of a 2-hour check, you can see the improvement in responsiveness. So you're talking about 5 minutes versus 120. That's a huge step up in responsiveness, which is where the 25x number comes from as well. Again, let me pause there. Any questions here, Martin or Richard, or comments?
No, but I'm mindful of what a great audit trail this creates for the regulator as well, and also for families who then can be reassured that the response times are very good and that their loved ones are being well looked after. And if there is a challenge, then staff are going in very quickly to make sure they're all right.
Absolutely. Richard, did you have?
You're making decisions based on data. So data's telling a really important story, and you're able to make decisions based on that data, I think, which is really great. What I'd love to hear a bit more about is kind of like the overall return on investment for this type of technology.
Absolutely. So in terms of ROI, you have two different buckets here we need to look at. One is the return on investment for the health sector all in, and then you have the return on investment for the care homes themselves, right? So if you think about the care homes, if you for the NHS, as you mentioned, it's a huge in terms of financial benefit, there's a huge financial benefit first off for NHS. And if we are preventing falls, if we are able to prevent 70% or 80% of the falls consistently across the homes, that's a huge financial benefit for NHS, because there's not many people going into the hospitals as a direct result. And as Martin mentioned, 40% of hospital admissions from care homes directly follow a fall. So it is from a fall prevention perspective, there's an important element there that we need to tackle. But besides the financial aspect, there is a huge psychological element here. So once the person falls, there is a huge impact that it leaves in the person's life and the quality of life. And I'm sure, Martin, you can talk a little more about that, because you've seen a lot of this as well.
Yeah, I mean, I think, one of the things that's really important is to focus down on a person to make sure that you're responding to that individual's needs. That then also has significant impacts on their quality of life. It also means that you can really see, because of the fact you've got data, you can really see where people's needs might be changing, and then you can respond to that in a very effective way. And those graphs were really helpful, because they identified, in one case, you identified that Christmas Eve was the pivotal moment at which something happened, and that made their condition worse. And then you can work with that to say, right, well, how do we get back to a more normal pattern? But of course, what this data tells you is what normal looks like, so Correct. You know what you're aspiring to return to. Yeah.
And from an ROI perspective here for care homes, it's we talked about the NHS there, and also for the residents themselves to improve the care planning aspects and go more proactive from a reactive standpoint. But from a care home perspective, you also have a lot of time is spent right after a fall. So there's a fall-related time that is wasted, which can be avoided if we are to more proactively handle the falls challenge. And secondly, when you think about the technologies that are in play, obviously, if you have more proactive monitoring in place, that's going to improve your reputation as well as a care home. It's going to mean you don't have as many falls as somebody else, and so that could also translate into direct bottom line financial impacts, where you can look at fee uplifts, you can look at all of those additional benefits. It's not just about cost saving, it's about improving the quality of care for the residents, which have direct reputational impacts, which can also improve your financial line. So all in, it helps the NHS, helps the care home, helps the resident, helps everybody to adopt technologies that can truly move the needle from reactive to proactive.
And of course, that reduces the amount of time that staff have to do in terms of, for example, if there's been a fall, there has to be a lot of administrative work associated with it. You might have to also send a member of staff to hospital with a person, particularly if they've been living with dementia. And of course, that's a really big issue in terms of the logistics of how you staff services. So on all those levels, the return on investment, I think, is very good in terms of the fact that it does deliver proactivity. It reduces critical incidents, but when you also reduce the critical incidents, you also reduce a lot of the administrative burdens that go with them.
That's right.
Thanks, Martin. I think the other thing is probably some of the behavioural insights are incredibly important. It feels like the gift that keeps giving, because I think there's one point you talked around the 55% improvement in sleep, and we know is when their bodies recover. If they're going to recover from an illness, that's the time when their bodies actually do that. But what we've seen in some other studies outside of these forms of technology is that the residents sleep better that changes the whole culture of the home. Behaviours that challenge people calmer, even more relaxed. And what we've seen very recently is that has a significant impact on recruitment and retention of staff. So happier residents, healthier staff. That means that if staff are happier, they're less likely to leave. And we've seen some significant reductions where staff are staying longer, leaving as quickly, and that's a huge issue for the sector. So I think it's the gift that keeps giving, and the response times of 25 times faster, being able to really be more efficient within the service. And I mean, falls reduction is a huge cost saving to the NHS, a huge cost saving to the care provider. It's a huge value add to the resident who doesn't have to go through all the pain and displeasure that they experience as a result of a fall. And it's the biggest cause of death, falls, in those who are over 80. So it's really important that we try and get those risks removed. And I think it's probably important just to ask Martin, sort of in terms of AI-driven monitoring, do you think this is going to become the kind of like the standard going forwards within residential care services?
Definitely, Richard. One of the things that we've got to see is technology aiding better outcomes for the people who use services, but also more efficiency within care providers. And of course, the other challenge is we know that we have a big issue about the numbers of people who need care. We can't afford to deliver the care in the same way that we've always done. And I think new technology is the way forward. It's going to give us the opportunity to deliver much more bespoke, personalised care. It's going to be proactive, so it's going to reduce the amount of people who go into crisis. It's going to create audit trails, which will then give assurance to regulators, to families, to staff, to managers that services are working effectively. So on every level, this is going to be the thing of the future. And the people who are embracing it now and are embracing technology in this first wave are going to be the ones who gain the advantage in the future, because my view is this is going to come. It's the next phase of the, in effect, technology revolution. And those who are on the front foot are going to be the ones who are going to reap the biggest benefits.
That's great, Martin. And I think it's probably worth coming to you on this. You hinted about it a moment ago. Martin mentioned it then and previously around the CQC. About a high 70% of the sector is either implementing or has implemented digital social care records. We're implementing technology at pace across the sector. But, we've got to have automated compliance and what have you. Can you kind of just talk us through the importance of how Earzz in the session, but integrates with technologies, but the importance of integrating these technologies together?
Absolutely. I, in fact, had a nice slide to present just on that, Richard, magically present. But having said that, let's go through it. In terms of what we share with DSCR systems, we are all for making sure that the data insights that are required for proactive care planning lands in the place that most people use. So if you think about DSCR, CMS systems, we share a whole bunch of different data sets now. So our system is not just about alerting for sounds. We can share those sound event records themselves. But once alerted, the carer goes into the room. There is an audit trail of who's attending, and also when they push attending, which device did they push it from. And once they enter the room, it also they register their physical presence in the room by pushing the button too. So all of those records are sent straight into the DSCR systems that we integrate with. Besides that, we also have anomaly detection models that run in the back. So one is understanding what the behavior is, but the other is if there is an excessive amount of coughing or excessive screaming or excessive movement, excessive restlessness in certain residents' rooms, that's information that can fit very nicely within a care planning system. So then the carer or the manager can know that this person did not have a good night. So there's an audit trail there, there's evidence there, but it also is information that we feed straight into the DSCR system so they can take proactive actions based on those. Besides the DSCR integration there, we also have weekly reports. So the system automatically generates weekly reports based on any changes in behavior that the resident has had. So that's information that is shared straight into the manager's email. So they know that there has been a change and they can start taking action based on those. And we think in the end, what we're doing here is to try and present as much of the critical information that is needed to help move the needle from reactive care to proactive. And that also means getting the right information sat within the right elements in the DSCR system as well. So we've begun forming integrations there. We already integrate with CareVision, and we've just signed the partnership with PCS as well.
Fantastic. I mean, we hear a huge amount of artificial intelligence. I think you've really managed to bring it to life for us today. And I know I've learned a lot more than I knew before I came to this session. So I want to thank you for that, because you brought it to life and we can see actually how it's going to have a very significant impact. There's a lot of talk about AI, but you really have kind of brought that all to life. I think before we sort of move into wrap up, I think it'd be really helpful to understand what's next for Earzz.
We will do more of the DSCR integrations. We realize that while we've done a couple of integrations with CareVision and PCS, we are looking to expand that to ensure that the data sits in the right frameworks for multiple care homes, not just a select set, but we want to make this accessible as a technology across all of the care sector in the UK. So that's something we are focusing on as well. And we also keep improving our systems based on user feedback. So the product's not done, it'll never be done. So it's a matter of constantly learning and evolving based on what the care homes tell us. So we are always looking for feedback, always looking to improve. And in fact, I have a little sneak peek on what that means. So recently we heard back from a care home manager that while this is great insights, it is often hard for her to get to this insight as quickly as possible. So she was asking for more detailed analysis. So here's a nice view that we'll be launching fairly soon, which will talk to, you can now look at a certain time range, you can choose a time window, you could look at certain monitors, and you can see how many check-ins have been done, rooms with the most check-ins, all of those critical information sets. How does the number of check-ins change by the time of day? All of that becomes part and parcel of what we are now going to offer. You'll also have behavioral anomalies and trends directly presented on the dashboard. So just making, while we may have the best information here, we want to make it as digestible, as easy, as streamlined here for care home managers or even management teams to access and utilize to improve the quality of care. So that's where our focus is right now, and that's what we will be doing going forward as well.
Fantastic. And Martin, anything else you'd like to say?
No, I just think that this has been a really useful dive into the benefits of AI-generated systems. And I can see that there are so many benefits, ranging from the outcomes to the person who uses the service, the staff being able to respond and make sure they use their time the most appropriate way. And for the organization, it shows that there is really clarity about how you've responded. And then that's an audit trail for the regulator, and also it helps you with your management systems to be able to say, we know if there are problems in particular areas, that's the time we need to make sure there are enough staff, and other times we might know that we can have less staff. So it really does help you with that whole management of resources issue.
Fantastic, Martin. I think, Martin, for people of our generation, just 5 or 6 years ago with these paper-based records, the future is really here. And probably back to you, Prad. I mean, Prad, but for anyone who's interested in AI-powered monitoring, what's the best way for them to start?
Absolutely. Well, thank you so much, Richard. So first off, we are attending the Care England conference, the Game Changer conference that you're hosting, Richard and Martin. So we are super excited, and we can't wait to be there. So it's on the 30th of March, so we'll have a stand there. So anybody who is there, I would very, very much welcome the opportunity to meet and also discuss Earzz. You can see the product live. You can see the dashboard that I've just gone through live as well. So you can see the data for yourself. And if in case you're not attending the conference, then please feel free to reach us on earzz.com, and please book a demo. We'd be very happy to show you what we have to offer as well.
Thank you very much. A huge thanks to Dr. Prad and to Professor Green for your insightful kind of discussions and views today. To everyone who's listening, if you're keen to learn more about Earzz, please visit www.earzz, that's earzz.com. Information can also be found on the Care England website, which is careengland.org.uk. Huge thank you, and we look forward to seeing you all again soon.
Very good. Thank you so much, Richard. Thank you, Martin.
Thanks.